Welcome, everyone. My name is Tobias Mattei. I'm the deputy editor of the North American Spine Society Journal. And I have here with me today Dr. Ingar Naess, who is the author of an article published in the June edition of NASSJ entitled Bicycle-Related Cervical Spine Injuries. Thanks for being with us today. And we'll be discussing this paper and some of these findings. So would you mind first introducing yourself, maybe a little bit about your academic background and how did you ended up involved with this research?
Thank you, Tobias Mattei, and thank you for the invitation. So my name is Ingar Naess. I'm a medical doctor, and I currently write my PhD thesis out of Department of Neurosurgery, Oslo University Hospital. So we started this project because we took note that there was an increasing amount of bicyclists being treated at neurosurgical ward, and they really made up quite a substantial amount of the patients that we saw in the daily work. And at the same time, there's the authorities of Oslo is really promoting bicycling as one of the preferred modes of transport. So in Europe and in Norway now, it's really popular to use bicycles for commuting. And the public numbers and public figures, they're not really correct because they're based on police reported files. And a lot of bicycle crashes are never reported. And that's really like the take-off point for this paper.
Okay, so let's give our listeners a little bit of background of the study. So this is a retrospective cohort study of registry data, mainly focused on the southeast region of Norway and included about 3 million inhabitants. And basically you evaluated the incidence of bicycle-related cervical trauma, and that includes both fractures and cervical spinal cord injuries. So would you like to describe to our listeners the general findings of your study in terms of the epidemiology, the incidence of cervical spinal cord injuries, as well as some of the patterns of fractures you found and some of the findings of the multivariable logistic regression analysis you did, just to give us a general overview of the results?
Okay. So basically, then we compared cervical spine injuries of cyclists to cervical spine injuries of other causes. And we did see a difference in the age. Like cyclists are generally younger and healthier. And so we were, not so surprised to see, but we did find a difference in the fracture types. Like the cyclists really often, like the second most common fracture was a occipital condyle fracture, while the odontoid fracture is really common in the general group, but it was more seldom among the cyclists. So we did a regression analysis to see the differences there, and we found that the occipital condyle fracture was really associated with cycling, and like more advanced serious head injury, while the odontoid fractures, they're more associated with higher age. So that's some of the general findings.
Okay, perfect. And any surprising findings regarding this study? I have several of them that I could mention maybe, and then you can comment on those. So I was very surprised to find like a 16% incidence of riding bicycles under the influence of alcohol. And that's something that definitely has significant importance for policy making and for future strategies, prevention strategies. There was also the finding that 29% of the cyclists were not wearing helmets. So that's another area that certainly could be addressed by programs encouraging the use of helmet. Even though you discuss in your papers, I think there's a quite strong literature showing that helmets are protective of traumatic brain injuries, but there's even some literature suggesting that because some helmets may increase the weight of the head, they may make cervical spine injuries or cervical spine fractures more frequent. So I'm not sure that there's enough consensus in the literature to support that helmets protect against cervical spinal cord injuries, but it's definitely something that is somewhat concerning in terms of safety for bike riding. So anything else that you would like to mention, or maybe you can comment on some of these findings?
So we had, as you said, about 16% of cyclists being under the influence of alcohol. And we have decent numbers decent data. So we know at least 16% were affected. And I think that's, we were doing some more studies in trauma to see if this is reproducible, but we have another study with about 10%. So, don't drink and drive, I guess, or don't drink and ride.
Mm-hmm. So one of the things you mentioned is about being reproducible, and I would like to ask you because, I mean, I'm not very familiar with the geography of Norway, and you can tell me if there's any difference between, even among Norway regions in terms of the Southeast region, if you think this is generalizable to the country, but at least in terms of generalizing to the wider worldwide community, I at least have the impression that the Nordic countries are in the forefront of promoting bike riding and non-fossil fuels modes of transportation. So do you think, so my question, do you think this is generalizable at least to the Norway population as a whole and maybe to Europe or other countries? Or do you think this is mainly a local phenomenon because you have a very high incidence of cervical spinal cord injuries? I mean, it seems that 12% of the total patients with cervical spine injuries and fractures were accidents related to bike riding, which is pretty surprising to me.
Well, in terms of generalizability, I would say yes. To Norway, it's pretty generalizable. In terms of Europe, I would say yes and no, because Netherlands, of course, have a lot higher share of bicycle riders than we do in Norway. In Amsterdam, they have about 30% of all work commutes being performed by bike. Copenhagen is probably around 25%, while Oslo is around 7%. So, of course, that's not really comparable. But yeah, to Stockholm, I would say yes, it's probably comparable. To the United States, I think it's a bit different. Probably cities like Seattle and New York, there's more commuting bicycle these days. Am I right?
You're right, and I can say even Chicago, but I live in St. Louis, and I would say in most cities, I think there are a significant proportion of spinal cord injuries that are related to bike riding, but I would still dare to say that most bike riding is still recreational and not for commuting purpose. Or even downtown, we have some places here in St. Louis or in one neighborhood in Clayton where you have the bike lane. But most of the times it's just to go from that neighborhood to somewhere close, and if you want to go much further, you have to cross the highway or something like that. So I think we're still lagging behind in terms of that type of use of biking for transportation. And so would you like to, do you see any limitations in terms of the methodology of your study and maybe the variables you wanted to analyze, or maybe when you're collecting the data, you saw that maybe there was not all the patients had those variables, or anything that you think for future database register studies that could be addressed in order to better cover the epidemiology of cervical spine injuries during biking?
So with the incidence of 1.7 per 100,000 persons for cervical spine injury, that would be around 90 people in all of Norway. And I think that's a quite a large number. But a limitation then is that we don't really know how these injuries occurred. Like we haven't really controlled whether they are single bicycle crashes or collision with motorized vehicles. And that information was not available in our registry as it wasn't really made for the study. So that's definitely a limitation that could be addressed in a follow-up study with either questionnaires or more like a prospective cohort where we actually collect this type of data.
And I definitely believe that, I think this is something that is unique to database or register studies. Usually they provide a very broad overview of a topic, but it lacks some of the granularity for us to be able to establish some of the causal relationships between the findings. So it's very good to describe the findings, but if you want to infer any causation or any meaningful association, you run into those type of problems where you just don't have the necessary information in terms of the exact mechanism of injury and the energy involved in each injury. So, and I don't think there's any limitations in terms of, it's an inherent limitation of the type of study and not any flaw in your methodology. So to our readers, what are the main takeaways of this study? I mean, we all know that this is a very important topic, especially with the new policies promoting healthier ways of commuting and stimulate bike riding. But at the same time, we want people to be healthier and live better lives. We also want them to have, we will also worry about their safety, right? So we want to stimulate bike riding, but at the same time, we want to have policies that account for the safety of this type of transportation. So what would you say that are the main takeaways of this study in terms, especially for policymakers and future prevention strategies in this area?
Well, I think a very cool thing about this study is that it kind of describes the daily work of the neurosurgeons at the department, and with the shift that's been going on with an increasing number of injured cyclists that are at the neurosurgical ward. With the cervical spine injuries. So I believe it's we for policymakers, I'm not against cycling. I think it's healthy to cycle and it proves general public health, but the infrastructure needs to be on par. And the status of bicycling in general, I think it needs to be like promoted further, and that the cities can't be based or developed for cars if you want transportations to be performed by bike. I think that's one of the main take-home messages of this study.
And one of the challenges, I definitely believe that the infrastructure is a very good point that you raised, because if you really want to stimulate that type of transportation, you need not only to redesign your main pathways throughout the city and make sure that's done in a well-planned fashion, but one of the things that concerns me and interests me is the aspect of policy making and the aspect of legislation. So one of the findings, for example, that of these studies is that 16% of the accidents occurring with individuals under the influence of alcohol, it's something very meaningful. And I think it's a very good target to address. I'm just not sure how feasible that is, at least not in the American environment, to require or to in some way bring liability for people that are biking under the influence of alcohol. And that's mainly because, I mean, it's not something that requires a license from the government. It's a personal activity. You could argue that they put out other people under risk, even pedestrians and maybe those involved, those driving their cars involved in the accidents. But I just don't see an easy way. In the same way we have legislation against driving under the influence of alcohol, and it's a misdemeanor, and you can be charged with that, you can lose your license. I find it somewhat hard to come up with legislation to forbid riding under the influence of alcohol. Although I'm all for it, but I can see in the future, I think this is going to be mainly focused on educational strategies and campaigns, rather than any formal policy to address the issue in a more strict way. I don't know what's your opinion, and maybe taking account the legal system in Norway, do you think that could be done in a different way?
So in terms of alcohol, it's already legislated against over here. So you might actually lose your driver's license if you are caught with biking in a very non-safe way for either yourself or for pedestrians or other people on the streets.
What would you say? Because I mean, do you? So what happens if you're riding your bike under the influence of alcohol? Do you lose your driver's license in Norway?
At the worst case scenario, yes, but it's not as harsh as if you would be caught under the influence when you ride a car. But worst case scenario, you may lose your driver's license.
Okay, that's very interesting. And the same thing about the helmet. I think it's a little bit easier, for example, to regulate motorcycles because the license itself it's related to riding the motorcycle. But I was wondering if you can see this happening, or if there is even already a policy there that requires the use of helmet for bike riding, and if there are any consequences in terms of liability for the individual. That because ultimately this is mainly self-protection, right? So it's not that the government shouldn't be addressing the issue, but at some point you have to draw the line, and there's a broader discussion about whether the government should be enforcing measures that are good for you, but ultimately you decided not to pursue that route. So what about a helmet use?
So for helmet use, I think different countries have taken quite different approaches to it. In Australia, I know they legislated it, and it seemed to be working. Like most riders there now use their helmets. In Netherlands, they haven't legislated, and really very few bicyclists use them. In this study, we did find that it didn't seem to affect cervical spine injuries in any way, really, which is also found in a decent review. You discussed it a bit earlier, but I still, we did see that the number of concomitant head injuries were fewer among the riders that did use helmets. So I do believe they really work to protect your head towards injuries. In Norway now, I think, or in this paper, we found that 70% of bicyclists did wear them, which is quite a good number, seeing it's not legislated by law. And I think the way we did it, like, it's really promoted by traffic organizations and the government to wear the helmet. And it's really succeeded for the last, I would say probably 15, 20 years to increase the rate of helmet wearing in the population. It's a good way to do it, because if there's a few people that really don't want to wear it, they're allowed to not wear it. And as you said, it's a personal safety choice, but there's a lot of papers showing that it really works to protect your head from serious injury. So it's also a public health topic, yeah.
One other interesting topic that I found, and maybe you can comment on that, because I was not familiar with that, and maybe our listeners might have never heard about that, but you mentioned a combined helmet neck brace airbag called Swedish Hovding. How common is that, and would you like to describe to us? I was just wondering, I mean, that seems to be a pretty effective way of preventing not only head injuries, but also addressing the cervical spine injuries. And I was wondering how would be the acceptance of that maybe in the American environment?
So, as you mentioned, the new Hovding helmet, it's actually like an airbag helmet, and it's a neck brace designed as an airbag neck brace that on impact, it inflates and covers your neck and your head. So it's, well, I have no disclosures. I just find as an interesting device or new helmet. So it's made in Sweden, and it's becoming increasingly popular in Sweden and Stockholm. And it's available in regular sports stores also here in Norway and Oslo. But it's not too common yet. The experimental studies are quite good, also performed by independent researchers. But we don't really know how effective it is out on the streets.
For sure. And as a physician that regularly treats cervical spinal cord injuries in our level 1 trauma center, I can tell you these are always catastrophic situations, especially taking account if you're treating patients that are polytrauma. And I think in your study, you found the average age to be around like 50, 55 years old. So you're already dealing with a population with some degree of comorbidities. So it's not uncommon to see a patient that was still fully functional and working, and they come with a high cervical spinal cord injury. And you have to tell the family the patient is going to be either tetraplegic or tetraplegic with significant functional limitations. And at that point, I'm always mindful that how important prevention is. And I mean, even if you have to wear such type of devices, and even if it prevents one cervical spinal cord injury in every 10 or 100 crashes, if you look how catastrophic from the social, economic, and especially from the personal standpoint for the patients these injuries are, it's definitely something that kind of strikes us as neurosurgeons. My feeling is that we can always do the surgery to stabilize the spine and reduce the pain. In cases with incomplete spinal cord injury, we can do a laminectomy and preserve residual function and try to regain some function. But that's still far from being an effective therapy in terms of mitigating the damage that already happened. So, I mean, definitely these high energy traumas are an area in which our therapeutic resources are limited to the point that I believe that significant economic resources should be employed in prevention strategies. Anything else you would like to highlight regarding your research? I was very excited reading this article, especially with the number of patients that you evaluated, the comprehensive nature of this registry database that encompasses the past 5 years. And I think it reflects very well, as you mentioned, at least the overall environment in Norway, probably in some of the Nordic countries. And it always gives us an idea of what may lay ahead for us here in the US, especially if we engage more proactively in terms of stimulating this type of healthier ways of commuting and reducing the transportation with fossil fuel vehicles. So I was very excited, and it's a pleasure to have this published in our journal. Anything else you would like to tell our listeners?
I think we covered it quite well.
Okay, perfect. It's been a great pleasure to have you in our podcast, and we look forward to future researchers from our group, either in this topic or in other similar topics.